dancing.
That was a catchy little tune.
That was.
Yeah, I love it.
Love it.
Hey, Corner Crew, it is Christina and Cindy with Adaptive Equipment and Caregiving Corner. Normally we are on the road with Rolling with Ruby, but today we have a special episode that we're calling it Engines Off, Let's Talk.
That's right. And today's subject is incontinence.
Yes.
And we know that that's a subject that a lot of people kind of shy away from and don't like to talk about, and a lot of times people don't even like to talk to their doctor about it.
Yeah.
So we actually brought a doctor on, Dr. Laird, to speak with us about incontinence. We think it's a very important subject. We kind of cross that bridge with a lot of patient care.
Yeah.
So
Cindy and I are rehabilitation therapists, so we do deal with it quite a lot with our patients and everything. We've talked about this before as home health care patient or advocates, and but we thought we ought to bring a medical doctor in, and so that's where we got Rosemary Laird. And so we're just going to go through that same topics, Dr. Laird, that kind of Cindy and I talked about, but because I feel like it's something that's hard for people to talk about, even with their own family caregivers. It's probably even harder to talk about with their primary care physician. And so we kind of want to break that stigma about talking to, because it's really important about talking to that with their primary care physician. So we appreciate you being on here to help us break that stigma with our audience.
Yes.
Oh, absolutely. Hi, ladies. No, I'm very happy to be here. It's not just the patients who are nervous to talk to their physicians or their providers. It's the providers sometimes who are a little nervous about talking about it or bringing it up. So there's plenty of stigma to go around, but no, I think I'd love today to give everybody some understanding of why it's such an important symptom to let someone who does know something about it help you, because there are things we can do about it, and there's implications and problems if we don't take care of it. So no, I'm totally on board and happy to do what I can to help.
Absolutely. So most of our audience, Dr. Laird, are caregivers, they're family caregivers. And so we wanted to kind of go through some topics or some points or tips that we could give them to kind of help support a loved one that may be experiencing incontinence. And so the first tip that we have is to seek medical attention, which is kind of why we've got you here in the first place. Is there something that you could recommend to caregivers to have that conversation with their family loved one? Or to bring it up with their loved one's physician.
So I think I'll kind of separate those two, like talking to your loved one and talking to the physician. Maybe we'll actually talk about talking with the physician first, and then we'll go back. Don't let me forget. We'll go back to talking to your loved one about it. What I think really helps physicians when you bring any symptom to them is if you come with some information about that symptom in as much detail as you can. It's kind of like the who, what, where, when, why sort of that we learned, to ask questions and be curious about. For urinary incontinence, a really good strategy is to take notes in what we call a bladder diary. And essentially that's just a way, and you can just do it very simply, a piece of paper that put the date on it and start writing down the times that your loved one voids urine. And if you're keeping track of bowel movements, there could be good reason to do that. I would put them all together. The physiology of how we urinate and how we have bowel movements goes together quite a bit. So start your day to the extent you can, find out the time of going to the bathroom to urinate and or have a bowel movement, and just start writing it down and keep track of it. You can also add information about when your loved one has a leaking episode or loses large amounts of urine. The more detail you can put about what's happening, the more your provider is going to understand the situation. As you're doing the diary, keep in mind that overnight is a really important time for understanding how the bladder and bowel work. Now that's tricky for a caregiver who we want to be getting good rest.
Right.
But
Absolutely.
sometimes if this problem is interrupting sleep, you already are up.
Right.
So go ahead and do the logging at night too, because it is going to be important to know what's happening during the day and what's happening at night. Believe it or not, there can be different reasons for daytime incontinence compared to nighttime. And there are definitely different solutions sometimes. So giving your provider that really rich understanding of maybe 3 days and nights, that would be plenty of a diary to bring to your provider. 3 days and nights of your observations of what's happening with your loved one's bowel and bladder habits.
Excellent.
That would be a great way to start, because whenever we're nervous about something, you know, having a little piece of paper helps us as a patient. Give it to the doctor, and believe it or not, for the doctor, that piece of paper and that data, they'll be a little relieved too, because they'll say, okay, I don't have to ask questions. I'm going to look through here and then have a little head start. So that's a great kind of icebreaker around that.
I love that too. And I know we try, there's the stigma of the language that is involved with it as well. So like we tend to call it incontinence episodes. But I like that you use something simple as leaking. I think just the language of incontinence, it can be hard to talk to your physician about it. So even the term leaking, are there other words or something that somebody could maybe feel more comfortable saying instead of, incontinence?
Yeah, that's a great question. I mean, leaking, most people, that's the least troublesome word, at least in my experience.
Yeah.
Wetting sometimes upsets people, but I have heard people use that. And lose control is sometimes a euphemism for it that doesn't get into any of the moisture event, if you will. So so he lost control, but you do need to specify bowel and bladder. So just make sure when you do that, you clarify which it is.
Okay.
So I do want to make sure we go back to this sort of issue of how you talk to your loved one, because surely if you're paying attention for 3 days, day and night, and you're taking notes, your loved one potentially is going to be aware, depending on how you handle your surveillance. And it is a hugely embarrassing symptom. Huge. Many people do not want to be called out for this whatsoever. On the other hand, many people are also highly concerned about the potential that they'll have an odor about them that's related to the incontinence. So oftentimes, if you're a caregiver, you know your loved one better than anyone. So follow your own instincts about how to handle this. But often helping your loved one from a position of, I understand this is a really difficult situation. I can't, empathize. I can't imagine what it would be like to be in your, situation. I really want to help you. We are going to need to talk to someone about this. Can we talk about it? Can I take some notes so that we can, efficiently and respectfully get some information in a way that doesn't make you feel as uncomfortable? If your loved one knows you're going to keep the diary and you're going to help with some of the discussion, sometimes that helps your loved one feel a little more comfortable about being, having that whole episode happen. Because I've had plenty of patients who just refuse to go to the doctor to talk about it because they think they're going to have to do the talking, and explain. And as important as that is, and your loved one may in fact get asked a question about how they feel before the leaking happens or other symptoms that are associated with it. Giving your loved one that assurance that you're going to start by you, the caregiver, is going to take some, lead and ownership of helping get the conversation going with all this information.
Yeah.
So sometimes that's enough to give your loved one the confidence that, together you can get this done.
Yeah.
Certainly it doesn't always work. And sometimes,
Everybody's
caregivers have to be creative about getting information to the doctor that something's happening, and trusting in the doctor to bring up the topic. So there's different ways around it, but these are generally good suggestions. And I did also want to say one other thing about the idea of, don't go in and say, my loved one's having urinary incontinence. You want to, this is just a general tip.
Sure.
You want to avoid going in with a diagnosis.
Right.
You're there with an expert who knows symptoms and what they mean. And the list of what any symptom means is long. So when, as a healthcare consumer, if we go in and say, hi, Dr. Jones, I'm having, migraine headaches. Well, Dr. Jones is a human being, and he knows you think it's a migraine, and he thinks you're a smart person. So maybe it is a migraine. And so you start talking about migraines.
Yeah.
That headache may be nothing of a migraine. The same thing can be true of incontinence. So you report the symptoms, report what you're seeing, and have the professional help you sort through that.
That's excellent. So again, back to the language and stuff. So instead of going in with the word incontinence, going back to the leaking or wetting or whatever, terminology works for the caregiver.
Right. I really am happy that you brought that up, Dr. Laird, because, going in like that, especially as we're aging, I think a lot of preconceived notions are, well, we're going to become incontinent. And, there are a lot of underlying things that can be going on. And sometimes I believe this is true, that some of this can just be solved with medication or some changes and some different things.
Management.
But just not assuming that, this is just what I'm going to do. And then I've got to go out and buy a product, and I've got to, all of this other stuff. And I'm going to be incontinent for the rest of my life,
Yeah.
Yeah, I think that's a really important point. Aging does have certain inevitabilities. Certain things are going to happen to the body. Urinary incontinence does not fall in that category. So it's not a mandatory change of aging.
Right.
It is common, but it is not mandatory. So you should not say, especially if you're a trained professional, that anyone coming to you with symptoms of leaking urine or not being able to control bowels, that's you're just getting older. That's an incorrect understanding of the aging process. And so, yes, I'd love the viewers to know that. Don't let anyone tell you that. Now, it could be that some of the effects of aging are related to why someone leaks. So someone who has arthritis and other aged hip joints and can't get to the bathroom quickly enough, and their arthritis and aged fingers can't unzip quickly enough, and they leak while they're trying to sit on the commode. That's incontinence that's somewhat related. But again, it isn't the aging process alone. So you need to be looking for these other conditions and circumstances that may be contributing. And you're definitely on the right track to point this symptom out, because the data is really impressive that even up to 80% in some studies of the people who had the complaint of leaking or incontinence through some sort of intervention were able to reduce that incontinence.
That is
There
awesome.
sometimes cannot be complete elimination of it, but the number of people that can be helped to reduce the amount of incontinence or the frequency of leaking, the data is quite good that if you take this comprehensive view from a medical standpoint and functional standpoint. Like, what are your circumstances? Can you open your trousers quickly enough?
Right,
And can you
yes,
move to
right.
the bathroom quickly
Right.
enough? If you combine that with a medical review of different conditions, different medications, different, abnormalities of other illnesses that can contribute, you can make almost 80% progress in reducing the incontinence in some
Wow.
series.
Awesome.
That's
So it's
fantastic.
worth it. It's
Yeah.
well worth it.
So we're going to take a quick break and hear from one of our sponsors. But when we come back, I want to talk about management and training kind of work. That'll make a nice segue into it. So let's hear from one of our sponsors.
If you're a caregiver dealing with a client or a loved one who is having incontinence, or an individual dealing with incontinence yourself, stay tuned. SENI has an entire line of products for men and women, including skincare, bladder control pads and guards, briefs, pull-on underwear, underpads, and much more.
All right, so that was SENI. They
Yes.
are an incontinence product,
Mhm.
and something that we've tried out. We've actually, well, you saw Cindy on there, and
Right.
we actually we feel like, because we deal so much with caregivers and mostly with seniors and stuff,
Right.
that when we get a product, we try it out as professional healthcare workers. We want to be able to say we've walked a mile in their shoes. So when we get the product, and to say that we've actually tried the product out, which includes SENI.
Yeah.
So Cindy actually, SENI sent us some product, and Cindy actually tried them out. And we were
Right.
talking earlier about odor and about, just the sensation and the feeling.
Mhm.
And so I feel like, Cindy, that gave you like a really good, and for me, as somebody that probably
As a
would have been more in the
caregiver.
caregiver role,
Mhm.
it was very eye-opening. So
Right. I mean, just being overnight and the worry of, am I going to get the bedding wet, and being out in public and
Mhm.
worrying about, can anybody tell that I have this on, number one, and am I leaking through, and all of that type of stuff. And, we do work with SENI. There's a lot of good products
Yeah.
out there, but we have worked with them, and we know that they have a very good product. And just saying that, we learned so much. We've been in the field for 30 years,
plus, yeah.
and I feel like we have, of course, always can get educated, but
Sure.
learned a lot more in regards to the incontinence, as far as what the incontinence product needs to be able to deliver to you. And it's not just going to the store and getting the one that's the most absorbing.
Yeah.
It's more about, what is the right style for you? What is the right fit? And then what is the level of absorption that you need in your product, which was a real eye opener for us as, working with people.
So SENI as an incontinence product is a way to help manage incontinence, Dr. Laird. But are there some other tips that you could give caregivers and our audience about how to manage that and help support a loved one that's living with incontinence?
Sure. So I think SENI is a good example where you do want to think product, but even in SENI, they have a really nice product selection tool, and it uses the letters of their name, SENI. And the reason I love SENI so much is, you know what the I stands for? Improve incontinence.
Nice.
They want all of you to first, if you're at the point of needing their product,
Right.
first learn, educate how you can improve someone's incontinence, because they know how devastating this symptom and aspect of daily life is to have. So with regards to that, I think the first thing you can do to improve incontinence is take that diary, write to your doctor, and find a provider. If your own primary care provider isn't knowledgeable or doesn't have the knowledge to help you, ask for someone who is.
Mhm.
There are sometimes in many communities urogynecologists who are specifically talented and experienced in managing incontinence.
Mhm.
Other communities have amongst their nurse practitioner ranks nurse practitioners who specialize in gynecology of older women. Some of the gynecologists in the community may have partnered with a nurse practitioner who is focusing on that. So asking your primary care provider if they're not able to help you as much as you need about additional specialty resources would be a smart place to go. And in many communities, the physical therapists of the community are also very knowledgeable among their own ranks of someone within the community who has a special interest in urinary incontinence, because we probably can't go into all of that today, but there's a lot that has to do with strength and weakness of pelvic muscles that goes into incontinence. So keep in mind those other clinicians who may be able to help you, because you want to get to someone like that to help you have a thorough review of your loved one's medical conditions, their medications. Everyone thinks of urinary tract infections first, and that may be what it is. So you do have to start with that, but you're going to also want to have other discussion about other facts, other aspects that can make incontinence a problem. So you definitely want to do that. But then I also think while you're getting ready for your visit with the doctor and you're doing your diary, you do want to find a good product, because the sooner you get your loved one feeling dry and comfortable and not in distress about this symptom, the better. Not only for their physical, but mostly for their emotional. Cindy, you already mentioned, people don't want to leave home. People want to stop drinking. Because if I don't drink, I won't, leak urine.
You get dehydrated.
You dehydrate. I've actually had patients completely dehydrated because of how much trouble they have. So you do want to find a product. And what SENI also uses as part of their educational offerings, along with their products, are these 3 sort of reminders that make up the rest of the letters in their name. The S stands for size. So please be sure you're getting the right size undergarment, because the last thing you want to do is have your loved one agree to wear an absorptive underwear, and then you have the wrong thing. That either gives them irritation and it's very uncomfortable, or it causes them to leak around it, and that's a mess, and they get very discouraged by that. So be sure you're choosing the right size. The E stands for essential features, and what that gets to is kind of what Cindy was referring to. Some of the products are more powerful in their absorbency than others. And depending on your loved one's symptoms, you may need to look for the more powerful, especially if your loved one's having trouble overnight, which tends to be when there are larger volumes of urine. But there's also some people who have daytime urinary incontinence that involves large, unexpected voiding of large volumes of urine. And they need the nighttime kind of power absorbency during the day, because no one wants to be surprised and then have an undergarment that is not powerful enough to help control the fluid. So understanding that goes a long way. And then the N stands for night versus day, because it is critically important for all of us to have a good night's rest. But what we also need is to have our skin, especially the sensitive skin in our perineal area, that is dry and not becoming a place where rashes and ulcerations and sores can set in because of excessive moisture. So dryness at night is very important. And so some of the products you'll see have nighttime designation versus day for that reason. It's a whole, sometimes people, just for the caregiver's knowledge, it's very common to have one product for night and one product for day.
Okay.
Very, very common if you're kind of managing it at the, top tier of
Yep.
quality and attention. Many
Right.
people have different products because your rhythms of urination and voiding can be very different. So you want to have that. So, that to me, those are some of the important things to do as soon as the symptom starts, to also show your loved one that you're invested in helping them adapt to this and deal with it.
Yeah,
Right.
So
that's a great idea.
Dr. Laird, another thing that I was thinking about whenever I was trialing the SENI product is I feel like a lot of people think about those products as kind of a urine catcher, and they don't think about the more in depth of the fact that, especially overnight, those products should be wicking that urine away from your skin, like you were talking, and it should be keeping it away, and it should be keeping it contained, and it should be breathable. And that's kind of what we're finding with the SENI products and a lot of the products out there. But it's interesting because I had a client that I was talking to, and the caregiver was up and changing almost every hour to 2 hours. And, I was talking to her and I said, a good product should actually wick that urine away and keep that away from their skin. And I actually think the product she was using she just saw it kind of as a urine catcher. And now my loved one is laying in a wet, undergarment. Now I need to change them. And so just educating people on the fact that that's what they're for, is to use it overnight so that you're not having to change every hour to 2 hours.
Yeah, for the sleeping.
Right. Oh, you're so right. The sleeping is so important, but so is dry skin. So to me, these undergarments are skin protectors. So it's interesting to hear you say, urine catchers. And I know that that's what people think it is, but to me, it's a skin protector.
Yeah,
that's
skin
an
protector.
Great way to reframe it. Yeah.
And that's why the breathability is so important. And one of the things I love about SENI, and I can't tell the story and the facts as well as their national sales manager, who's done a lot of great work in understanding like the purpose and the mission behind this product. And one thing she uncovered was this old-fashioned rule that many on the call may have heard if they were in the health professions and long-term care. The idea that every 2 hours you have to get somebody out of bed and change them and put on a dry brief. Well, that is because in the past, products weren't skin protectors. They were urine catchers. And they didn't resolve the moisture issue that I was talking about. So you had to wake people up. You had to get them out of that wet environment. Now we have products, that SENI has brought into the picture that are able to provide a much higher level of dryness and skin protection. And in their system, there is a indicator on the undergarment that identifies when the moisture at the skin level is a problem, and then you need to change it. So it's more based on your loved one's urinary activity and need and their skin's health than it is the clock. Because their product will do what it needs to do as far as the skin protection. So that's very important, not only for the loved one's sleep and health, but for our caregivers' sleep and health. No human being can be responsible for every 2 hours being awake to do something like that on their own at home. And there's no reason for it, but you got to use the right products, and you have to have the understanding of how these products should be working for you and how they then can be used. But
absolutely.
That was a really good point.
Crew, we really appreciate you being here. We're talking to Dr. Rosemary Laird about incontinence. We're going to take a quick break, and when we come back, we've got some questions we want to ask Dr. Laird from viewers that are watching the podcast. So we're going to take a quick break and watch something about one of our other sponsors.
We might be going to a
Maybe.
break. Here we go. Are we going? Let's see. We were. We're going to keep talking a few more minutes.
There's some
and then we're
questions.
gonna
Yeah,
talk.
we had some viewers had some questions, Dr. Laird, and so if you
Sure,
hang in there,
I'm game.
Okay,
Okay.
we'd love to ask you those questions.
Okay. So let's see. What are some of our questions here?
Oh, yeah.
Yeah.
Well, we can
Oh,
see
I
those.
see.
Yes, we can see those.
Okay. Yeah, so somebody had a question that I thought was good. I'm a speech therapist, so I'm about language, right? So, so what I saw somebody was asking about the language that's used. Let's see. Does language around incontinence change culturally or with age?
So I'm going to have to admit, and I'm embarrassed to admit it, but I don't know culturally. So
yeah.
I apologize
No.
that I don't know that, and I'm going to work on that because I don't know.
Yeah.
I know with aging, that I would say that I kind of think of it like this. If you guys look around the world now, maybe you've got younger family members who are much more open, I believe, about talking about all sorts of things, mental health, women's menstrual cycles. I mean, the world is just much more sort of open and comfortable in some respects, talking about things that used to be very close held.
Mm-hmm.
In my practice, my oldest of my adult patients, this is one that is held very close and private. I have long married couples who do not enter the bathroom
Wow.
with each other. So sometimes even the diary is a new level of intimacy, really, and sharing that they're not used to. So it is important. And let's face it, we want to be our own person, and to have someone in the room or even involved in that personal of a habit is a real threat. So I do think, to me, the words are the same. They do talk about leaking, or most of the time I would say my oldest patients are the ones who use the euphemism of I didn't make it in time.
Right.
You know, I had an accident. I didn't make it. Whereas the younger crowd will say, yeah, I was leaking, or, you know, I had a bowel movement. I couldn't control, something like that. They will use those more descriptive terms that are becoming a little more okay in their generation. But it's a very private matter. I think, in my experience, the older my patients get.
Absolutely. Yeah,
Absolutely.
that was a great question. So I think we got our technical issue solved here, Sin. So let's hear from one of our sponsors.
Falling asleep with your head in the wrong position is a pain in the neck. You deserve Tausi Comfort for head, neck, and back support. Go to tausibrands.com and get your comfort on.
All right.
Okay,
I think I want one of those pillows already.
Yes.
I know, that looks nice, doesn't it?
I like that. Yes.
I use my all the time.
Not even so much for your neck.
I use mine for my low back.
And I was just gonna say, could I put it right behind? I need something for my lumbar. Could I put it right there?
Yep. Do the U shape up. And I do it I use it in my office chair. I use it when I drive. It's a very, the actual size of the support is perfect for the low back area, because it's not, a lot of people try to do too much bulk in doing that. And it doesn't take that much for a little support back there. So very, very nice.
Good. My birthday's coming up. I've got a suggestion for the family.
Put on their wish list.
That's right. That's right.
So let's talk a little bit about prioritizing accessible environments, which is kind of big. So we're talking about, and what's your experience been with, like grab bars for the around the toilet area, the little step up that people are using now. I know it's not really I know the physical therapist is probably just like, no, don't step up, but it's like a little tool that people put,
Not
Do you
the-
mean the squatty potty for the
Yes.
feet?
Not the step, not the step.
Yes.
So as
Okay,
a
okay.
I don't step on
I know.
that.
Right.
Yeah.
So, okay.
We're toilet
So,
racing.
yeah, but I want to say something ahead of getting into the bathroom, because yes, we'll go over everything you just said when we're in the bathroom.
Yeah.
However, what I want to just point out is that one of the big contributors to urinary incontinence for anyone, in the later years of life
Yeah.
can be the functional aspect of getting your body to the bathroom and
That's
getting
a
ready
mobility.
Right.
to void.
Yeah,
So during the day, sometimes it's, are you close enough to the bathroom to have enough time between what your current state of trigger notification is from your
Right.
bladder to your brain to
Yeah.
say it's time to go?
Mhm.
Is your path, clear? And
Right.
and not just metaphorically clear, but
Yeah.
Right.
physically clear. Do you know where the bathroom is? Is there any reason it wouldn't be available when you get there?
Right.
Does your adaptive equipment allow you to get in there wherever it is you are?
Right.
And so just keep that in mind from an accessibility standpoint. And sometimes what, especially from a caregiver standpoint, you can do is you can help in a proactive way before there's trouble,
Right.
start to become really savvy about where the bathrooms are that you're going.
That's an excellent.
Are they
point.
accessible? It's a little extra time, but it's time well spent. And the other thing I'll say is a very underused strategy to help reduce incontinence
Mhm.
is to stop relying on the trigger I just talked about.
Mhm.
Our bladder telling our brain, telling our muscles to move. Start
Yes.
just doing it by the clock.
Yeah.
Or by the fact that you're about to leave a building that has a restroom.
Right.
Yeah.
You make use of those restrooms along the way.
Mhm.
And every 2 hours in general is
Yeah.
often the time that will allow most of us to not leak in between. Now, that's not a guarantee for everyone, but
Right.
every 2 hours while you're awake,
Yes.
even if you don't think you need to void,
Yes.
Right.
go and sit and try to empty your bladder.
Right.
And that often, like I said, will help. It won't eliminate trouble for most people, but it will reduce it. So
Yeah.
caregivers, that's another piece.
Yeah.
Depending on your loved one's situation, some of us cognitively lose that internal ability to use time and keep track of time in the way we used to. So our caregivers need to help their loved ones, follow the clock. Some people use timers. Some people just have a lovely wife or husband to help them.
Yeah, right.
I've had people set up their home Siri to say something every couple hours.
That's a great idea.
So usually they pick a fun euphemism for that they know means go to the bathroom. But anyway, so that's something I just want people to think about the ahead of time into the bathroom. Now, once you're in the bathroom, I think I heard rails, which is good.
Toilet seat riser.
Yeah, toilet and the toilet seat riser and the squatty potty.
Yeah.
And the reason I think those are all good is because they all help our body kind of be a little younger.
Yes.
When we get older, the way the muscles of the pelvis change, and the way the pelvis changes in women in particular, and even men to some extent, there's changes of aging that change the sort of logistics, if you will, of the body in that area. Well, the squatty potty puts you kind of back in a position where, even though everything's shifted down there, the muscles have a better shot at helping you. So that you can generally have better voiding, primarily of the bowels is what the squatty potty helps. But I mentioned earlier, they go together a lot.
Mhm.
If the bowels are moving well, the bladder is less irritated. Bowels that are constipated irritate the bladder tremendously.
Isn't that
So
interesting?
that's one of the big causes or contributors of urinary
Yeah.
incontinence the older we get, is if the bowels aren't moving well, because they kind of live together actually down there.
Right.
And
Yeah.
so if the bowels are not able to be evacuated and regular, that can impact your urinary ability. So that's why I think that's a good trio. The rails help with the overall musculature. The rising of the seat puts you back in a position of strength.
Right.
And then the squatty potty is the right sort of orientation for the internal organs.
Yeah.
And that's good.
Right.
Someone asked earlier, I saw it come along the bottom of the screen about exercise and does that help? And I think this is a good moment to say yes, because we exercises of two sorts. I just talked about the pelvic muscles. Those are the muscles down in the bottom of our body that are kind of holding everything in.
Yeah.
If you've heard of the Kegel exercises, many of the women probably have. Unfortunately, for the fellas, people don't realize, but men can benefit from Kegels too. They've been left out, unfortunately. I'm sorry, fellas. But Kegel exercises encourage the muscles in the bottom of our body to hold everything in better. And they live around the sphincter that holds the bladder closed, especially in women, specifically in that case. And so having more strength in those muscles means more control.
Right.
The other muscles that need to be strong are the muscles of the hip flexors, which are the muscles that allow us to stand up and sit down and get to the bathroom on time.
Right.
So exercise both in general for the hip flexors and specific to the pelvic musculature, the Kegel exercises definitely have been shown even into advanced ages. So any 90-year-olds on the call or people with 90-year-old loved ones, they can still work, but you do have to do it like any exercise of anything. You've got to do it regularly. And And don't be afraid to ask for some tips about that. Again, a physical therapist often can help. Your primary care provider should be able. And even if they say, "Oh, that might not work," say, "That's okay. I'm just going to try it."
Do it anyhow.
Because you know what? The research shows that it can help. So there's no harm to it either. Zero harm.
Yeah.
So I'd say do it.
Yeah. Dr. Laird, I wanted to get your opinion on, so a lot of times we have clients that, it's the physicalness of, like you said, getting out of bed and getting to the toilet in time. And of course, we all know that when that happens multiple times at night, the fall risk really increases. So, a lot of times we will suggest, just for nighttime, let's put a bedside commode next to the bed so that you don't have to make that quick trip. And maybe you're avoiding the incontinence episode altogether. What is your opinion, though, on if we're having incontinence episodes and if we're not sure what's happening overnight, maybe we wear some type of an undergarment, some type of a brief. But I think I would encourage people, if you get that urge, if you know that you're having the incontinence episode or you've got to go to the bathroom, go ahead and get up and use your bedside commode. But I guess my thing is balancing. Someone would say, well, I'm going to be getting up 6 times a night, so then we have this disruption in sleep. But then I'm concerned about them, if they've got the right incontinence product, it will keep them dry. But what is your view on that?
So remind me to talk about the bedroom setup if I forget it. So somebody remind me. But to answer your specific question, I tell people this: if you or your loved one is awake and knows they're getting the trigger to go to the bathroom, they should go.
Okay.
And then the place they should go is the safest place they can go to void with lowest fall risk possible. And that's where I get to my bedroom setup.
Mm-hmm.
So one of the things that can be really helpful is the bedside commode.
Yeah.
Mm-hmm.
Not everyone is open to those.
Right.
Yeah.
And they aren't 100% for everyone,
Right.
because depending on someone's size
Mm-hmm.
and
Mhm.
mobility, but especially size,
Right.
some of our much taller people or larger people, the bedside commodes tend to come in one size fits all.
Mm-hmm.
And so you have to be very careful that that's a sturdy place for this body to land,
Correct.
to go to the bathroom, alongside a caregiver in the middle of the night helping them.
Right.
If you've got two people, or, if you've got paid help, it's a different story. But if it's I'm picturing kind of husband, wife, or
Right.
daughter with their mother or something like that.
Mm-hmm.
You just got to look at the physical size of the person who's involved, the loved one, and know you've got to get them to a safe place. It can be the bedside commode, but it may not always be. So get them to a safe place to void.
Mm-hmm.
One of the reasons I said bedroom setup is one of the risk for falling is people who are sleeping opposite where their access to their bathroom is.
Mm-hmm.
So if you're sleeping here, but you have to go around the bed to go to the bathroom there, those people just cover more territory, and there's a dresser and a nightstand and the edge of the bed in their way.
Right.
The people who are sleeping here going to the bathroom right there have an easier path to the bathroom. Now, I know it's like thermostat wars. Like where you're sleeping.
Right.
I get it.
Yeah.
And you can't, your caregiver undoubtedly has their own issues and challenges. So but just think about it.
Right. Absolutely.
Just figure out what's the safest. And I've actually seen beds moved in a room in perhaps an atypical way from what you normally would have. But if, a bed move like this gives both people a little bit better, straight access is better than having to make a bunch of turns around obstacles.
Absolutely.
So just something else to think about. And then the other thing I wanted to mention about the safest route to the bathroom is for the fellas, there are the handheld urinals.
Yes.
And there are some interesting devices being created for women that are in the bed or bedside type of options. And so I would encourage, thinking about that, because a fall for people who are frail can be one of the most devastating things that can happen to someone.
Yes.
So anything you can do to reduce fall risk is an overall benefit to that individual. And so the adaptation sometimes of not leaving the bed and being able to void, again, we don't want, skin moisture. So if some of the handheld devices or a personal device for women can work, then for some people that may be the right solution. So hopefully people have people like you two to help steer them in the right direction, and someone to give them some individualized guidance. But the thinking should be, how can we get our loved one to the safest place to void with the least likelihood of falling or having some trouble along the way?
Yeah, absolutely. Absolutely.
So, Corner Crew, we were talking to Dr. Rosemary Laird about incontinence. We've got one more thing that we want to talk to her about, but first we want to go to our next sponsor, who it is the mobility towel. So we'll be right back.
So as you can see, you can grab the loops, and with the weights, it's going to allow that towel to stay. You don't have to grasp the towel. You don't have to grab it.
Yep. Another great product.
I know, right?
I know.
Mobility towel.
Again, we've tried everything. I
know.
tried that out.
Yeah.
I always tell people I was a little skeptical when I first saw it. I was like, am I really going to get dry? I really did get dry.
Yeah.
It's amazing. It's a great towel.
It is.
Makes
And
it much
I
more
like
accessible.
the functional. I mean, it goes with the SENI products or with any of the products that we do. It's that functional independence.
Dignity.
It keeps your loved one with their functional independence, and it's certainly with their dignity,
Right.
maintaining their dignity. So,
Right.
yeah, the mobility towel is awesome.
Mm-hmm.
So, Dr. Laird, we really appreciate you being here. So we got one more area that we want to talk about, and it is about open communication and emotional support of your loved one as a caregiver. So any tips you can give us on that? We kind of touched on that, I think, at the beginning, but it certainly bears repeating.
Absolutely. And especially around this urinary incontinence, I think it sometimes is the last straw,
Yeah.
I mean, everybody who gets older starts having everything happen to us, right?
Yeah.
You're
Seems
changing
like-
and this part stops working and that part stops working. And
Yeah.
and a lot of us, get through many changes and adapt without too much difficulty. But
Mhm.
this one sometimes seems like the last straw and can
Yeah.
really be a reason for overt depression, as
Absolutely.
well as social isolation, as we
That's
discussed
huge.
earlier.
Yeah.
And it is. And I really think that to the extent you can as a caregiver, and again, and some of our caregivers are going through these things themselves.
Right.
So I really, really feel for our caregivers who have to kind of, absorb all of this, potentially yourself as well as for another person. But I really encourage you to continue what you're doing, which is seeking out information that can help you, learn more ways to adapt. And that's what I love about what you two are doing is, aging is definitely not for sissies, as it has been said far
That's
more
right.
famously than me. But I'm always sort of the glass half full kind of person trying to think about, well, what are the adaptations? I mean, I put glasses on at age 13 and adapted without much fuss.
Right.
And if you think about it, that was sort of my body's first foray into aging. Was my eyeballs needed the lenses. So if we can kind of bring it to that sort of normalized level and reduce the stigma that we all have, and I'm hoping that these earbuds reduce the stigma of hearing aids
Right.
in the future.
Absolutely, yeah.
Yes.
So if we can all, by talking about this more and by getting more people this information, we can all help reduce that stigma of urinary incontinence. Like, oh, don't talk about that.
Right.
I think, but back to your point, at a personal level, I would understand that personal embarrassment is a huge driver of isolating and, not wanting to deal with something. If it doesn't make sense why your loved one's, not going here or there or blah, 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 it is it's very possible it's related to something that's personally embarrassing to them, because that's human. I would be the same way.
Yeah.
So as a caregiver, as gently and carefully and lovingly as you can, get with your loved one, make it a team effort, make it something that you're doing for each other, so that as challenging as it is to adapt to aging, you want to do it in as successful a way as possible. And here are some steps we can take. We'll do it together. I will help you. One thing I always do with my families that are helping someone who has Alzheimer's disease or a dementia is I always try to talk to them about, as you're thinking of helping someone, think first of, how would I do this so that they can feel and we can be successful in what we're doing? So what are the steps towards their being successful here? And with urinary incontinence, you know what one of the markers of success is? Nobody knows it's happening because of that stigma.
Yeah.
Right.
So what you want to do as a caregiver is say, look, I got your back. I'm going to make sure I'm going to know where the bathrooms are. I'm going to have an extra SENI in my bag. Or I'm going to also be talking to the doctor to make sure there's not something we're supposed to be doing And if a medicine is a new medicine, I'm going to say, is there any chance that will disrupt, urinary incontinence or cause urinary incontinence?
Right.
Because asking that question, you might get the clinician to say, well, let me double check how these medicines might interact, whereas otherwise they wouldn't have done that. So you giving your loved one that sense of, I got your back on this, and not sort of requiring them to kind of, be out there sort of fighting the fight for themselves with this extremely personal thing. I know that's a lot on the shoulders of the caregivers. I get that, but there isn't anyone, we know we need each other. And so what we can do is put programs like this out to help the caregivers, because that's my other plea, is that I hope caregivers, a long time ago, I wrote a book called Take Your Oxygen First. And it's meant to remind family caregivers that amid all this responsibility that we've just given you, and now you've got a bladder diary to write, and you're staking out bathrooms and figuring out, what time it is. In the middle of all that, I want you to take a deep breath. That's a cleansing breath. That's actually a medical act when we take a deep breath like that. It lowers our blood pressure, it clears our mind, reduces stress in that little tiny way. But it's a healthy thing for a family caregiver to do, is to just make sure that amid everything else, they're taking some time for themselves and some oxygen for themselves. This is a good example. You guys qualify as oxygen today for caregivers.
Oh, thank you.
That's
awesome.
So,
I love your point about trying to reduce, the stigmatism of around incontinence, and the fact that that's part of why we're doing this, because we keep telling people, with all the adaptive equipment, your function is going to change as you age, but you can still be functionally independent. We want to throw incontinence in there too, because everything about us changes, and we want everything to be kind of out there. We want to be available for people to ask questions to. That's what we're here for. And that includes incontinence. And if we don't know the answer, we're going to find people like you that do.
But the key though is, for a caregiver, for the loved one who already has incontinence, we don't need them to be the poster child for it. That's just too much. So as a caregiver, you're going to take on, getting all that information, and in whatever way they need you to, as private as needed for them to feel comfortable, that's how you're going to help them. But I think for the rest of us in the world of helping people age and live with that, I love and just really think you guys are smart to put this kind of content out, because it's definitely necessary.
We appreciate you talking with us.
Absolutely.
So we were going to put the SENI, there's a QR code, you guys, that you're going to see on the screen. If you scan that code, it will take you to a SENI website that you can learn more about SENI. They're one of our sponsors. So just take your phone out, scan the QR code, and it will drop you off where you can learn more about SENI. And I'm sure they'll probably have the acronym on there that we went through, Dr. Laird, the SENI. This was really great. This is really great. I knew it was going to be a great show, but I mean, just the things that, even as a healthcare professional, that I learned talking to you, Dr. Laird, it makes it just that much. I mean, that way we'll be able to go and we can kind of spread the word a little bit more to our clients and everything, and try to get the word out there. So we really appreciate your time. I want to thank our other sponsors, Mobility Towel and Tausi. Next support system. And hopefully maybe we could have you back again someday, Dr. Laird, if you're good with that.
I'd love it. No, I'd love it. Yeah, I love doing this kind of stuff. So thank you for the opportunity. Yeah, you're more than welcome.
We appreciate it. So I guess
our crew.
That's all we have. That's all we have for the day. So we really appreciate you guys joining us, and we'll see you in the next video.